Hello, class. Um, hope everybody is safe and sound and survived the unusual snowstorm from last week. We certainly a more snow than most of us have seen in a long time in a 24-hour period. That's for sure. Um, this is a short video update. Lesson 3 discussion board grades I posted earlier today, so you should see those in your grade book. I also participated in the Lesson 3 discussion boards and responded to your posts and asked some questions and those type things. Overall, I'm really pleased with the discussion boards that we tend to be having, and some pretty good information is coming to the surface. Let's try to continue those high quality posts. Next up is lesson number 4. Well, first, before we go to lesson number 4, let me go back to lesson number 3 for a second. Lesson number 3, of course, you will remember, was on screening instruments and screening processes to help identify older adults who may be at risk for issues related to medication misuse and abuse. Basically, how do we identify those patients? And identification is extremely hard with the older adult population because of misdiagnosis. Many times, patients may have symptoms similar to prescription drug misuse and abuse or other substances that may be side effects of medication or other chronic diseases and problems. Or sometimes family members will see great-grandmother or grandfather exhibiting certain behaviors and blame that on the family member just getting older or the natural course of aging, when in reality it could be because of unintentional misuse and abuse of their medication over and above some, as they should. I remember a recent conversation I had with a family where the sister stated that so and so had come to her house. The younger sister, the two sisters, who were of a advancing age, came to her house, and the younger sister asked for pain medicine that they were both on. And the older sister asked, why do you need your pain medicine? You have the same prescription I do, and it's only halfway through the month. And the moral of the story is that the younger sister had already been through her entire prescription of what was Vicodin in a span of 15 days, and had already borrowed some from the older sister and was already out of that supply as well. And sometimes I wouldn't say that was intentional misuse and abuse, as we would compare that to other substances. I would say so many things are going on here, that the medication is being overprescribed by the medical physicians, perhaps, that the patients who are receiving so much of the strong medication believes, well, the doctor gave it to me, so it must be okay, and the idea that the only solution to aches and pains as we get older is a opiate-based painkiller. And all those things are really false. That we have so many other options out there, and many times. And I suggest that you take this exercise too, if you can. Make a comparison to the types and strengths and dosage of medication that's being offered to your older adults in your family, and compare those dosage amounts to someone who is younger, perhaps in their 20s or 30s or 40s. And many times you will find that those dosage amounts are the same, being prescribed by doctors, when they really should not be, As we get older, our metabolism slows down. We tend to lose weight, lose body mass, and our dosage amounts have to be different. Those dosage amounts have to be modified. Uh, um, so we should not be prescribing older adults so many times as we are the same level of milligrams or dosage amounts um, to those older adults as we do younger adults. The human body cannot absorb medication as fast when we grow older. But I say all that just as an example that this is an extremely difficult thing to do. To try to filter out with any patient, but especially older adults, uh, what symptoms are being, what symptoms are apparent due to a chronic medical condition or an acute medical condition, or because of side effects from other medication the patient is taking, or maybe unintentional or intentional misuse and abuse. It's just hard to filter out, almost impossible. That was lesson 3, of course. Lesson 4 is up now. Everybody should be working on lesson number 4. And we're going to continue this conversation about medication misuse and abuse in terms of how many of us, older adults and those of us of younger age, who do not take our medication as prescribed. And this is a major issue with older adults. That so many times, due to memory loss or lack of cognitive ability, or just free choice, free will, we as patients do not take medication as prescribed. We believe that we know more and know better than the prescribing doctors and pharmacies. Antibiotics is a perfect example of this. How many of you have been on a 10-day course of antibiotics? Then on day 6 or day 7, maybe even day 5, you start feeling better and stop taking the antibiotic. That's a perfect example of some of the issues we'll be talking about today. Because many of the problems that a medication creates for our older adults is based on inappropriate use. So we have issues with sometimes the medical establishment not understanding the unique dynamics of an older adult being prescribed powerful medication. And on the other side, on the patient and family side, we have patients who do not take their medication as appropriately prescribed. And when we have both issues happening all at the same time, we have nothing but a disaster, to be honest. We have some really good articles to read about the number of patients taking medication appropriately. Do doctors really know what patients are taking, and so forth. Some of these issues are getting better in terms of doctors knowing how many medications patients are taking because of shared medical databases, especially with the insurance companies and pharmacies. When I was in graduate school, we looked at research related to older adults taking prescribed medication. And most older adults were taking, on average, if you were over 65, around 12 medications per day or multiple times per day. And if that's the case, imagine how hard that is to keep up with every single day. Plus, how hard that is to keep up with and share with all the various doctors and specialists, especially doctors, you may be going to. And one of the best ways that we can increase medication adherence and taking medication as we should is pill boxes. And you will see a couple of examples of pill boxes in your lessons, especially in the first lesson on page 1 is a small pill box. But helping your older adults manage a pill box can be a life-saving effort, to be honest. Again, hope everybody is safe. And lesson 4 is the current lesson. with lesson 4 being due, let's see, February the 24th. So that's next week, next Monday, I do believe. Take care, and let me know if I can help.